Thank you, Mr. Speaker. A health system that does not have a well-engaged medical profession will not succeed. And in his November 22, 2012 letter, AMA President Dr. Michael Jufrey says, quote, "Does the minister really think he can run the health system without the confidence of physicians?" If the minister says yes, he does, then I have news for him. He's losing it. This cannot go on, unquote. To the Minister of Health, do you or don't you want the respect and trust of Alberta's doctors by treating them as partners in healthcare?
Honourable Minister.
Mr. Speaker, this government works collaboratively with physicians on a number of levels. The Alberta Medical Association agreement and the negotiations that are going on toward that end are one part, Mr. Speaker, of our work with physicians across the province. We can cite many examples, and I talked last week, for example, Mr. Speaker, about the improvements in acute care occupancy in our 7 major hospitals, in the significant reduction of number of patients waiting in acute care beds for admission to continuing care. Mr. Speaker, all of these things were accomplished because of the collaboration and leadership that physicians continue to show in our health system. We count on that as a government, Mr. Speaker, and we will continue to count on that.
Honourable member.
Thank you, Mr. Speaker. And given that we have amongst the most demoralized physicians in the province and in the country, and given that Dr. Lloyd Maybaum, president of Calgary and Area Medical Staff Society, said that the minister was trying to hoodwink and bamboozle the public with nonsense numbers and figures, and given that the government of Alberta recently placed radio ads advertising how much doctors are paid to the same minister, Albertans deserve to have a government that bargains in good faith. Why are you then wasting taxpayer dollars on radio ads instead of doing your job and getting back to the negotiating table?
Hear, hear. Honourable Minister.
Mr. Speaker, in the last month there has been some tremendous information released by the Canadian Institute for Healthcare Information about our healthcare system. And if the honourable member actually cares about the morale and the confidence of physicians and other health workers, other disciplines in our workforce, I'm sure he would agree, Mr. Speaker, that telling Albertans that the province of Alberta has increased the number of physicians in this province by 60% in the last 10 years, over 23%, compared to 23% nationally, I'm sure he would agree that Albertans want to know about that. I'm sure he'd also want Albertans to know, Mr. Speaker, that our physicians are the best paid in the country. 29% ahead of the national
Mr. Speaker,
average.
I do care about Alberta's physicians. That's why I spoke up about physician intimidation and gladly left that side of the floor for this side. And given that AHS has been a partner in the trilateral process of negotiating with Alberta's healthcare staff and doctors, and given that the result of negotiations will ultimately affect AHS operations, to the minister, you've cut the doctors out from their own negotiations with your unilateral imposition. Why have you also cut out AHS? Aren't they a partner?
Honourable Minister.
Mr. Speaker, if this honourable member's idea of leadership is engaging in negativity, cynicism, and personal attack, and if that's how he defines his role as a parliamentarian, we leave that to him, Mr. Speaker. We are engaged in discussions with the AMA toward a new agreement. We have a meeting scheduled for later this week, and Mr. Speaker, we're very confident that we will be able to reach an agreement on all the issues, but it will be the right agreement for Albertans, Mr. Speaker.